Well, we carried out this study to learn whether e-visits can make it easier or faster for our patients to get oral contraceptives. So, an ongoing goal of ours is really to reduce unintended pregnancy and empower patients. An e-visit can be chosen through the Kaiser Permanente Northern California membership portal. We serve about 4.5 million patients. And there's various ways to access healthcare. So you can do it through the website and go on and get an e-visit. You can do a phone visit, you can do a video visit, or an in-person visit with a clinician. And the e-visit really is like you go in through your app. It's a simple questionnaire that a patient can take online. And if the responses show and then once you go through the responses, and if the algorithm seems to show that it's okay and safe for you to take an oral contraceptive and it's appropriate, the patient will receive an email within our system confirming this, and then the patient can process the prescription pretty soon thereafter with our pharmacy and get their contraception. So this process may take a few hours, sometimes less, and it can be done from home or anywhere that you are. It doesn't have to be done at Kaiser. And then the member still has access to our website and our phone app via do all this stuff. So we compared four types of visits in patients trying to get oral contraceptives: the e-visit, which I described briefly, a phone appointment with a healthcare provider, a video appointment, or an in-person visit. And we found good outcomes actually for all methods. So the majority of all visits for all types resulted in the patient receiving a prescription for oral contraceptives. The e-visit, however, led to more prescriptions being ordered than other medicines, 92%, with 73% leading to actual pickup. So you can get something that can be ordered, but then they actually picked it up. At the same time, e-visits did not result in a higher rate of in-person follow-up other than other methods, suggesting that the process is safe and effective. So, people might ask, well, if you're doing this e-visit, what happens if something happens, or is there higher complications from that? We did not find that was the case. Thanks. Yeah, we looked at over 23,000 medical encounters for oral contraceptives in 2023. And these patients came from a variety of racial and ethnic backgrounds. 14% of the patients chose an e visit, and about half chose to talk to a doctor by phone. 10% chose a video visit with a doctor, and then 27% chose an in person medical visit. So we found patients aged 35 to 50 were more likely to choose an office visit. Asian, Black, and Hispanic patients were more likely to choose an e-visit over an office visit. And e-visits really had a very diverse selection of patient selection. And sometimes, as we know historically, people of color can have less access to care, or they receive different care. And so this was nice to see that e-visit still had a very diverse patient selection. So e-visits are somewhat unique to Kaiser Permanente and are possible because of our integrated healthcare model. For an increasing number of simple and uncomplicated health needs, our patients can choose this really easy online option, but they also have the option of consulting with a clinician if they need to. And patient-centered, this is patient-centered care, and it's more in line with the way healthcare is moving for kind of on demand or patient needed care. So we'll continue to study how e-visits for women's health are being used by our patients and their outcomes, and encourage this use of technology as another way for people to access contraception. I'm happy to see that our health system continues to innovate for women's health to improve access to important healthcare needs such as contraception. We really expect to continue research in ways to get easier access to other forms of prescription contraception. And I really want to thank my study team members it really does take a village to look at all these factors. We had two students working with us, Amik Bindra and Jade Sal Torres Rodriguez. We had a resident, Emily Bolton. Our analyst was Ji Huang. And we also had one of our other emergency physician doctors, Dana Sachs, as well as Mary Reed, one of our researchers as well.